Hello. So we are 1 month postpartum. Little Hankster's going to be 5 weeks old tomorrow. So we have officially survived the first 4 weeks. We've kind of been going through updates for your 1 week old baby and kind of 1 week postpartum for mom. So this is kind of 4 weeks postpartum for mom. How you doing? I would say personally, and I've found this to be true with the last couple, around the 2 week mark, I sort of started feeling like myself again. My pelvis was much more stable. Bleeding really starts to decrease then. Sometimes baby's starting to understand night and day, and then that all just continues to improve out at the 4 week mark. We'll kind of go through your boobs, your bottom, all of those things that we've talked about so far. So this episode is sponsored by Momcozy. I'm now a mom of 3 and an OBGYN who loves being able to provide breast milk for my babies while also keeping up with our busy schedule. An important part of this is having a breast pump that can keep up with me and my milk supply on the go. For this, I have truly enjoyed how easy and effective the Momcozy M9 wearable breast pumps are. What do I love? These pumps have 15 different suction levels that you can control directly on the pumps or with their easy-to-use app. This has allowed me to make changes personalized for me to optimize my output. And most of all, I love that I can be hands-free while keeping up with my day and that the battery is going to last long enough to make it through multiple pumping sessions. The design and shape of these is also pretty sleek, which allows for uninterrupted pumping privacy while I'm working through my day. If you are looking for a really great wearable breast pump option for you, check out the link in the description to learn more about the Momcozy M9, and you can also use the code Bjorkman for 10% off all Momcozy products. The boobs, as you can see, besides me and Hank matching here, this, I don't know if you can see it, the leaking nipples are getting much, much better. Instead of waking up fully soaked, we're just occasional leaks if he sleeps for too long. Again, breast milk supply is really getting established here. Usually by about that 6 week mark, we feel like we're about settled out in terms of it was not enough, then it was too much. We're kind of through the too much phase and now just about to just right. Little babes need, max, they're usually taking 20 to 24 ounces of breast milk is baby needs. And that remains the same until about 6 months when they start eating solids. So some babies are more on the 20 ounce, some babies are more on the 30 ounce end, but somewhere in between there is, what they're doing. So we're just about to the just right phase. I'm still experimenting with some different breastfeeding clothes to make it easier. This one's a latched mama. You can see this kind of outer layer pulls up, and then you can sneak, there's an under layer where you can get access to the boob. Like this, find this third go round. I've never really been into the cover because I feel like baby just gets so hot and I get so hot. But I do like things where my belly is still covered and like my upper chest is covered. So some of the like pull down shirts, I'm just like, there's a whole lot of my chest there as I'm sitting here wherever. And that's fine. Like if someone's bothered by it, I have to feed my baby. I don't care, but I found that I like a little more coverage this go round. And so, just keep my nice little belly rolls covered, and we're finding some good stuff. My water bottle continues to live with me. Drinking lots of water, making sure to get lots of calories, pumping. The pumping, I am back to work. You can't beat the Spectra for your base pump. Love. Have been trying the Momcozy wearables. Get a pretty decent output with that, and so I've been happy to have been trying that. Another little pro tip, I have these silicone flanges that have been very nice for pumping. They're just, I just like them. Didn't love the super hard plastic for my boobs. These are Lactech. OBGYN makes some cushions. There's different inserts that can make pumping more comfortable if you are an exclusive pumper or still figuring that out. Check out some of the different things. I have a video all about using your spectra, and we'll definitely do an updated video about my pumping faves, because now that I am headed back to work, yes, early, all about me wanting to go back to see patients on a very limited basis, but I miss them, so I've been trying to find the balance of be home with my sweet little babes and wanting to get back to my patients because I miss them, and I'm a little bit of a control freak despite how wonderful my partners are who've been taking care of them. I miss that, and so have been trying to find that balance of let's try to do a little bit of everything, and it's been going well. So back to the pump and the 3 pump bags and taking all that stuff to work. In terms of healing for your bottom or your C-section, that generally is pretty well healed. Usually your stitches are mostly dissolved by now, and bleeding is minimal, pretty light, panty liner-esque. I say we go from this and, you know, your hospital mesh panties to this, week 2, to, where are we now? Where are we now? Oh, it's stuck over here. To week 4, living the dream, right? So not officially cleared to swim yet in like pool, yucky water, but baths are great. Bottom's healing. If you feel like it isn't, with my first, I ended up with a nice little labial abscess and a very dry vagina. I saw my OB because I needed some vaginal estrogen. With that estrogen drop postpartum, sometimes your vagina feels that too, and you can have a very dry vagina that can be very painful. Things don't heal as well. So if you feel super itchy, like things aren't healing well, talk to your OB, because sometimes there's some tricks that will help things in that final healing. C-section, mamas, you know, we say at the 6-week mark, you are cleared to kind of resume exercise. At that point, you can lift more than 10 pounds. Really complete tensile strength is not fully there, you know, until the 6-month mark, but you are 80% of the way by about 6 weeks. And so that is where, in terms of wound healing, that's why we say, hey, it's okay to resume your normal activity then. In terms of what have I been doing for activity? Still very focused core breathing, connecting that diaphragmatic breath, that connected breath with your pelvic floor to work on healing the pelvic floor. My pelvis, again, definitely feels more stable. Every once in a while when I go to get up off the floor, I'll just feel that pubic symphysis shift a little bit and say, we're still a little loosey-goosey, but so much better than it has been. When, you know, still walks, going on lots of walks, doing some diastasis recti focused exercises. So every pregnant person has some diastasis recti, which is a separation of those ab muscles. And that is because you just grew a little human in there and your belly has to stretch to accommodate that. So some degree of separation is normal for everyone. Sometimes it gets much worse. This is the time when we're really working on healing it and working on gentle core exercises to rehab your core in that diastasis. I am doing the +1 program by Meg Squats. She's a power lifter who has created this pregnancy and postpartum program for weightlifting. I love to weightlift, always have. And right now the exercises are gentle stretching, doing like cat-cow bends while breathing, doing some leg extensions, clams, very simple things, really focusing on your core, and walking. I walked 5 miles around the track at the YMCA last weekend while Kurt was in the pool with the kids. nothing really intense. I do not really start anything too intense until 10 to 12 weeks because I really want to give everything time to heal in terms of like a running or anything that uses a Valsalva, not for a while, because again, the pelvic floor needs some rehab. At the 4-week mark, baby sleep is starting to get a little better here. We're getting a couple longer stretches. If I haven't mentioned it before, that I know I have, who are we kidding? That Taking Care of Babies newborn sleep class is awesome. We have a newborn sleep episode that is also really great. Newborn sleep is just totally different than adult sleep. Like their sleep cycles are different. It's totally different. And so right now in these first few weeks are when you can be laying down good habits, good sleep habits for your baby in the future. And so check out our video. If you want more than that 20-minute episode, check out Kara's whole course. It is gold. And also, again, enjoy all of the contact naps, all of the snuggles, because, you know, they say it goes fast. I have not found that particularly true with my last ones, but now with, I will say that now we are on to baby number 3 here. It goes a little bit quicker because you know what's coming. You know that, you know, you're going to have a crawler soon, and you know that you're going to be starting solid soon, and you know what a little 2-year-old is like and how cute they are, and with all their different things. Whereas with that first baby, you just don't really know what to expect. And I think of it as like if I go for a run and it's like a new route and I don't know where I'm going, that trip out, before you turn around to come home, it just feels so long to me. So long. And once I turn around to come back, oh, I know where I'm going. This is going to go so much faster because I know the landmarks and I know we're almost home. And I think that's kind of what it has been like with the newborn phase and with the subsequent kiddos, is you just know the landmarks and you know what's coming. So it feels like it goes a little faster. And that has been nice. There's a quote that says, "No season of motherhood lasts forever," and that is both a relief and a heartbreak, and I feel that much more this time. With the first 2, it was like largely a relief that the next season would come. But anyway, I hope your first month has gone okay. Other things to think about are your mood. This, you know, we'll check on it at your OB appointments, which is at that 6-week mark. I know partners are getting very excited about that 6-week mark. I think Kurt told me 10 days till that appointment the other day, and I had a good laugh at him. Your mood, the first 2 weeks, baby blues are pretty common, random crying, feeling really emotional. Usually that starts to go away after those 2 weeks. Sleep deprivation, needy babies, that can exacerbate it, and you want to keep a close eye out for postpartum depression or anxiety. They're so common. And if you feel like those feelings of sadness or tearfulness or not bonding with your baby or feeling like you want to harm yourself or don't want to be here are persisting, it is so important to talk to your OB, a friend, your pediatrician, anyone. Call the hotline, which we will put here below. This is really hard. It's really hard. It's really hard. And so I just want to wrap you in a warm hug. I want to come over and help you, you know, and say, hey, this is normal, but sometimes it goes beyond normal and there are things we can do to help. So congrats on the first month. Stick with us. We have lots of great stuff coming in terms of newborn care, sleeping, eating, starting solids, all that stuff coming your way, as well as great pregnancy content. Mamas, if you have any tips for that 4-week mark and surviving and thriving, please leave them in the comments below. We'll see you next week.
We're doctors.
But not your doctors.
Anything we've said in this video is for education or entertainment purposes only.
It is not medical advice.
Any specific medical questions you have should be directed to your provider.
It's okay. Hi. Hi. Maybe in a second, but we matched, so I just thought it was so cute, you know? Are you going to be happy here? We're so funny in that we say, oh, our kids really don't like to be put down. Why don't they like to be put down? Well, because we hold them all the time. Mom would hold you for every single nap, huh? And then I wonder why you don't want to sleep by yourself. Oh, yeah.